Well, welcome back to Pueblo Lincoln Foot Care's YouTube channel. We hope that as you've been watching these, that you've hit the subscribe button and liked what you've watched. We have another question that came in, and it's every time that we see patients that have diabetes here in our office that we make it a point to ask not only how their blood sugar was today, but also what their last hemoglobin A1C was. So these are numbers that we expect our patients to know, because what it does, it gives us a snapshot of how the blood sugars are doing and therefore how well their diabetes is being controlled. Inevitably, if the blood sugar is very high, if the A1C is up in the 7, 8, up higher in the 9, 10, in double-digit range, there's usually a lot of issues happening with the patient's feeling in their feet. It's not uncommon. I see this all the time if patients have had high hemoglobin A1C, which is the blood sugar test that tells us how well that blood sugar is done over a 3-month period of time. Inevitably, if they've had one that's been high for a long time and they've just complained to us about lots of numbness, tingling, pins and needles, burning, then they do eventually get it down and get it under control. Many times, having that blood sugar well controlled, their neuropathy starts to improve, and many times it resolves. Now, if this has been going on, neuropathy sensations for long enough, then it may never go away, even if the A1C gets back down to the 6 or 7 range. So really, what we recommend is if you've been experiencing neuropathy, please, please, please talk with your primary care doc. That's the first step in helping to get that improvement. We do other things here, though, in our office, different types of vitamins that are available here. There's also, we have the ability to make referrals to spinal cord stimulator implant doctors who do that regularly. There's also topicals that are available as well that can be very helpful. Those are just Band-Aids, but the nerve stimulator as well as the vitamins that we recommend can all be helpful in making really good improvements to your neuropathy. The one neuropathy that we have not had huge success for with regards to vitamins, though, is back-related neuropathy. All those nerves coming from your brain going down into your feet. If there's any disruption like a herniated disc or stenosis in that spinal cord, it can cause severe issues on one side, usually not on both sides equally, although that can happen. There's the A1C blood sugar ins and outs that I wanted to share with you today. Hopefully that has helped, and welcome you to our channel if this is your first time, and look forward to seeing you in the future.